Anyway, today we're going to do a adult female Caesarian. We're going to do a standard incision. She has a lot of vessels, which is probably going to make this a rather bloody affair. So as we go, we'll try to put some hemostats on them. It's probably not going to be the funnest thing going in. She also possibly has an umbilical hernia that we'll be doing at the same time. As she's an older female, we're actually going to de-sex her. That's our hernia just there. This would be a great one if you got cautery to use. There's always these two big vessels at the top that we'll try not to touch, just because they'll give us more grief. That's pretty good. So going through our subcutaneous tissue all the way down to the midline, trying to expose that linea alba coming up to our hernia. We'll just skirt around that. And then being ultra cautious that we split the subcut tissue right in the middle. It's not the end of the world if you hit those massive vessels up here, but we would definitely prefer not to. Having a look at our hernia, it's just fat. So go straight on through that. So what we're going to do, we're going to try to gain access to the abdomen around our hernia. So just enlarge that hole. Trying to stay on midline as much as possible. Good. So it's been 5 hours since she's whelped a puppy, and the puppies on ultrasound don't look very good. So imagine the uterus, compared to how we normally like them, is fairly tight and turgid and unhappy. Nice and gentle, trying not to cause too much harm. Good. Right. So we'll gain access into the uterus, trying to control the mess so it goes into one area. You can see how easily the placentas are coming away, suggesting that these babies probably wanted to be out a while ago. Particularly as I know that I'm going to remove the entire uterus afterwards. I'm just going to make as many incisions as I need to get them out. I'm going to go for this last puppy, which sadly will most likely also be deceased. This is the one that was clearly wedged. Might have some more gloves for afterwards, please. 8. Yep. So sadly, all these puppies have deceased. Change my gloves. Got it. At this stage, we'd normally go ahead. We'll be resuscitating puppies, and we would be closing the uterus, but instead we're going to go straight ahead and start to do a spay. General rules, I tell owners that if there's any concerns regarding the anaesthetic and whatnot, or how things are going, I won't spay them. If everything's going well, I'm more than happy to do so. Okay, so just like with any spay, we'll do this side first. We have our horn, proper ligament, ovary. Following that ovary down to the body wall, cranial and medial. You wouldn't mind giving half methadone IV, Jeremy? First clamp on. Second clamp on. Surgeon's knot. Moving our bottom clamp up. Ligature in the crush, thumb to thumb. So we'll do our checks and make sure that our ligature is not stuck in anything important. Got a good ligature that's crushed down, plenty of room between the ligature and the hemostat. We'll just cut on top of that. Carefully, we're going to release our pedicle, making sure that there's no bleeding whatsoever, back into the abdomen. Having a look at our broad ligaments. I think today we will ligate it. Why not? Make a hole close to our uterine artery. Through the hole and around. Just making sure there's no massive bleeders. Which there isn't. It's good. We'll go straight on to the other side. So again, uterine horn, proper ligaments, feeling for that suspensory all the way down to the body wall. Cranial and medial. Like that. This one's a fairly tight pedicle. Just got to be ultra cautious. Making a hole. First clamps on. Second clamps on, holding that ovary to make sure that I'm not incorporating it. Underneath the hemostats, through the hole. Surgeons. Remove our bottom hemostat, nice and careful. Pop it on top. I'm just going to go above the ovary. Very carefully, we're going to do our ligature in our crush. Making sure we're not incorporating anything. Thumb to thumb. Another 4 to 5 throws on top. Particularly for this one, making sure everyone's coming down perfectly, not incorporating anything else. All good. This one's very important to do our checks just because it is such a tight pedicle. So we have a single ligature. We've got a good wad of tissue above it. Not too close to the hemostat, thankfully. Not stuck in anything. Whilst holding that ovary. Run our scissors. Making sure that I've got it all. And now slowly release our pedicle. Again, just being very sure that there's no bleeding whatsoever. Good. Just like last time, because it's easy, we'll put a ligature around that broad ligament, make a hole nice and close to that uterine artery. to our hole. Snipping through that broad ligament and just having a look. Have some more swabs, please. For any massive bleeders, which there isn't, which is good. All good. Lastly, we're going to do our ligature. Feeling for that cervix and just going close to it. Carefully, we're going to put our first clamp on. Another clamp. Very big, thick wad of tissue. One like this, we're going to do a miller's knot, I reckon. So go around once, go around twice, through the hole, around and grab, releasing our bottom clamp, carefully. Thank you. Into the crush spot, because I want to make sure that this completely tightens down. I'm actually going to release a little bit that top clamp, thumb to thumb, holding for a good 5 to 10 seconds. It needs to be a very good ligature. And then following up 4 to 5 throws on top. I'll use 2 clamps. Just going to transect in between our 2 ligatures there. As always, we do our checks, so we make sure that our ligature is not stuck in anything, which it's not, which is good. We've got a very nice wad of tissue above it. look. Make sure it's not bleeding whatsoever. Release it back into the abdomen. Have a quick look in the abdomen, make sure that there's no massive welling of blood. Got a big old bladder. Looks really good. We'll proceed with the closure. Just have a look whilst we're here. We'll throw a couple of quick ligatures. See if we can remove some of these clamps. Alright, so now that we've ligated all those small little vessels, we begin our closure as we normally would. Just closing it as we normally would fix that hernia that we've gone through, which is good. Running along, engaging that external rectus sheath every time. Good bites. Another way of doing desexing at the same time as a Caesarian is you can do an end block removal of the uterus with the puppies inside of it. I'm personally not a massive fan of it. I find it's a bit more stressful. That's another very valid way of doing it. Whereas what we did here today is we removed the puppies with the thought process that some of them may still be alive. And then after doing that, we've gone on to do the desexing portion, as you would for any spay. All the way to the point of the incision. Just go back through and make sure they're all nice and tight. Certainly don't want to have any other new hernias. Can I please have a 3-0? Yeah. No, subcut. Thank you. Hopefully I won't hit these vessels here. That's always very frustrating. I've managed not to, that's good. As always, deep to superficial, superficial to deep. Starting off. Leave a tail. I'll try to do intradermals today. No. Can I have another 3-0, please? Oh, no. We're good. Every once in a while, we go down, we tack down to that linear alba, just to maybe help reduce the risk of a seroma. We get to this end, so superficial to deep coming up, deep to superficial. Superficial to deep, two things that are now deep. We'll do an Aberdean's knot. Underneath our Aberdean's knot to the point of the incision. Actually managed to go through the skin there. Sorry, actually, can I please have some of that 2O? Thank you. As that subcut layer, I shoved it through the skin and it would be hard to back it out. I just decided to change over to an external rather than fiddle around and cause a lot of trauma. All good.